In this video I'm going to talk about the upper and lower abdominal lipectomy. It's not a very common operation because most of the time we're doing a hybrid or fleur-de-lis or abdominoplasty or extended abdominoplasty or something like that. There has been a couple of patients that have just come to me and they've just got upper abdominal loose skin and lower abdominal loose skin. And in that situation we're doing just an upper and lower abdominal lipectomy. So again, I've got a separate video on that you can watch, but it's again not a very common operation that I do. There are some complications that we need to discuss. It is a little bit less of a complications than most of the other operations like fleur-de-lis, extended abdominoplasty, circumferential, because it's a limited dissection. We're leaving the belly button in place. We're not shifting a lot of skin and we're not undermining a lot of skin. So again, it could be a good option for someone that is having some chronic issues or potentially high risk of breakdowns or some other issues. Now, what are the complications like? Most are skin related. Why do they occur? So in a post-weight loss patient, skin quality and perfusion is a major issue after surgery. If you want to optimize your recovery after this operation, you need to make sure that you don't smoke, you have good nutrition, and you are prepared physically and mentally for the operation. What are the common complications? The most common complication is wound-related stuff. So minor breakdowns, wound adhesions, minor infections. That is by far the most common complication. Most of the time we manage that conservatively in the office. So wound dressings followed by potential wound debridement and things. Then you have the complications that can happen with any operation. So anesthetic complications, clots in the leg, lung issues, breathing problems, DVTs. With anesthetic side of things, nausea and vomiting is probably one of the commonest things that happen with that. With a scar, you will have a scar at the top and a scar on the bottom. So there's always a chance of hypertrophic scar, pore scar, widened scar, other scar related issues. And over time, we tend to, as you come in for your recovery, we talk about silicone strips. Sometimes we discuss scar injections of steroids to improve that. That is not an uncommon thing. In this operation, I'm not actually repositioning the belly button. So there's not going to be any issues with the belly button. The belly button is or umbilicus, is one of the most common areas that do have complications in other operations. I am lifting skin, so there's always a chance of necrotic skin. We are cutting tissues, so there's always a chance of nerve issues, sensation issues, shooting pains, numb patches. That's all possible. Fluid collections like seromas. So once you cut the tissues, you have a space. The body wants to fill spaces with fluid, so you can get a fluid collection or a seroma happening. And if that happens, we have to put a needle in, pull the fluid out, usually a couple times in the office, and then that settles. As with any operation, you can get bleeding. Bleeding hematomas, so mainly go back to operating theater. If you get infections, it could be superficial or deep. Superficial infections have red area, and if they're spreading and giving you shivers and temperature, you may need to go back to the hospital, have IV antibiotics. If it doesn't, then most of the time oral tablets will be sufficient. If it's a deep infection like an abscess collection, then you do need surgical treatment, and then we need to take you back to surgery, open up the wound, clean it out, and then put drains in, give you IV antibiotics, and that hopefully settles down after that. You will feel tightness because we are pulling both sides. That tend to settle down within 4 to 6 weeks. Pain discomfort is part of the recovery process. That kind of is the main complications to expect after this one. They are very, very similar to most of the other body contouring procedures. If you are considering an upper and lower lipectomy, book in, come and see me. We'll have a chat about the detail. You'll get all the information in the office as well. So see you in the next video.